September 5th, 2010, I walk downstairs after hearing a loud bang. I see that my grandfather has fallen on the floor. I was in 7th grade and he was 6'6", so I was unable to get him up by myself. I had to call for my mom, who was outside. They had recently started staying with us when we started noticing my grandfather's health slowly declining. A few weeks later, my grandfather was diagnosed with ALS and dementia. My parents immediately started having contractors add an addition onto the house so that my grandparents could move in with us permanently. Mid-November of that same year, my grandfather passed away peacefully in his sleep. This is just one of many dementia cases that are diagnosed every year. Some of you may not know, but according to Dementia Society of America, dementia is not a specific disease. It is a term used to describe a collection of symptoms that cause several different disorders in a person's brain. Some of the diseases that cause symptoms of dementia are Alzheimer's, vascular dementia, Lewy body dementia, frontotemporal dementia, Huntington's disease, and Creutzfeldt-Jakob disease. However, there have been recent studies done to help diagnose these cases so that we can result in better treatment and care for the patients. Now I would like to discuss with you how common Lewy body dementia is. According to Alzheimer's Association, Lewy body dementia is a type of progressional dementia that leads to decline in a person's thinking, reasoning, and independent function due to the damages to the brain over a period of time. Lewy body is the third most common cause of dementia after Alzheimer's disease and vascular dementia, accounting for about 5 to 10% of all cases. Lewy body is reported to affect more than 1 million people in the U.S. per year, and it tends to appear between the ages of 50 and 85. According to the National Institute of Aging, Lewy body also tends to affect more men than women. Lastly, I would like to discuss the symptoms of Lewy body dementia. Lewy body dementia can cause a wide range of symptoms in people as they get older. According to the Dementia Society of America, some of these symptoms include changes in alertness and attention, hallucinations, muscle stiffness, problems with movement and posture, and confusion. These symptoms can make diagnosing Lewy body fairly difficult, considering these are the very similar symptoms with Parkinson's disease and Alzheimer's. According to Mayo Clinic, other symptoms of Lewy body include sleep difficulties, depression, and apathy. Unfortunately, Lewy body is a disease that will only get worse over time. There are no cures for the disease, and the treatment is only specified to help the symptoms. In conclusion, Lewy body dementia is only one of many forms of dementia. This affects a person's ability to think clearly, and over time, damages to the brain affect a person's ability to move and perform other tasks. Over 1 million people are diagnosed every year, but unfortunately there is no cure or treatment to slow this disease down. Studies are continuing to be done to learn more about the relationship with Lewy body dementia, Parkinson's disease, and Alzheimer's. The effects of these diseases not only affect a person's ability to think clearly, but it affects their ability to move. It also affects the patient's family and loved ones who are close to them. I can advocate for this, seeing that I saw the effects that my grandfather faced and the difficulties that were placed in front of him after he was diagnosed. It is a hard disease to watch as it progressively gets worse. Hopefully, with the new technology and information, we will continue to learn on the issue, and there will someday be a cure to help treat or slow down the progression of this disease.